welcome to our walk-in mental health clinic. This is their 4th week of operation here. Nick said when we're done here, if you want to take a tour of the clinic, we should have enough time for that. They open at 9 o'clock, start seeing patients. But first, just a lot of work in the background behind the scenes to get this clinic set up for maybe even a couple years. A lot of work by these people over here. First, I'll introduce you to Nick Rozier. He's the manager of the clinic. He's in here every day, kind of seeing what's going on. He's going to tell you more about it.
Hello. Well, thank you all for coming today. So a little bit about the mental health walk-in clinic. It is the first of its kind from a med management standpoint. So folks are able to come in 18 and older and be able to get that kind of urgent behavioral health care. It can be anywhere from seeing a counselor from 15 minutes to 50 minutes, then to seeing a med manager to maybe starting on some medications. I think the need in the community has been the only place we've been able to go for kind of urgent behavioral health needs is the emergency room. And this just gives you a little bit more of a kind of a humane way to come and receive mental health care. Our goal is that we're here to hear you. Our goal is to make sure that we're kind of meeting that need. We know early intervention is the best intervention. So again, waiting for those appointment times, things like that, can be even more overwhelming for folks. So we are excited that you are all here. We are thankful for leadership and everyone making this a priority. We can already see how it is affecting people from all walks of life walking in this door, and it's really cool for our staff who works very, very hard each day to see folks that want to come in, get the help, and then walk out a little bit more comfortable with knowing what's next from a treatment side of things. So again, thanks for coming, and again, thank our staff as well, because they're working really hard, not only in this setting, but across kind of our system to meet those behavioral health needs that our community assessment continues to tell us are kind of our biggest hurdle that we have to jump. So again, thank you for coming, and I will introduce Pam Degler-Dell, and she will give a few more words.
Thank you, Ned. So I want to thank all of you for coming out this morning on kind of a rainy, cold fall day. If you've ever had a family member that has a mental health challenge, as a parent or as a daughter, it's the scariest time ever. And not having access to those services, and it doesn't feel like it's something you should go to the emergency room for when there's a pandemic going on, but there is such a great need for mental health in our community. Every 3 years we do a community health needs assessment. Every single time we do that, mental health is at the top of the list for what we need to provide for great services to our community. And so I want to acknowledge Amanda Shara, Nick Rozier, and this entire team for all of the hard work. We literally have been planning and thinking about this for years. It's a large investment that we are making in the community, but there's no better time to move forward with this than right now. We know that the mental health care concerns have risen dramatically during the pandemic, even with our own staff. And so I want to thank you for being here today, and I want you to share the news, encourage anybody you know to take advantage of this center. So thank you.
Good morning. We are the Purple Coats Ambassadors representing Cedar Valley. But before we speak and we cut the ribbon, I'd like to invite Mayor Hart to come up and say a few words.
All right, thank you. Good morning, everyone. Pam, staff, thank you so much for the incredible work. As we know, our communities across the country, across the state, are suffering with the lack of resources with regards to mental health. So I am so fortunate that I live in a community where we don't just talk about it. We're actually doing our best to come up with creative solutions to help holistically the people within our community. So Pam, staff, Nick, everyone, God bless you. Thank you so much for your work and your efforts, but you are helping to fill an incredible void in our community. So on behalf of the citizens of Waterloo, thank you.
leaders throughout the Cedar Valley that represent a different business that, or organization that's a member of Grow Cedar Valley. It's our job to come out and learn about all of the exciting things that are happening in Waterloo, Cedar Falls, and throughout the valley, so that we then in turn can go out into the community and spread the good news. So today we congratulate you, we thank you for the investment, and what we'd like to do is to have all of your staff stand in front of the purple coats, and we will do a ribbon cutting to make this official.
Yes, we do. Are you gonna get in there? You can count it down, Jane. You can count it down. You do.
I mean, if everyone's in the picture, you might as well.
UnityPoint. Whatever you want us to. We should have made a Okay. Here's the scissors, and we're gonna do a practice. So we're going to all say, after 1, 2, 3, we're gonna say mental health access. And then, if that's good, then everybody can say that one. I'll do it one more time and say 1, 2, 3, and then you can cut the ribbon. All right, so let me get out of the way here. You get in here. Okay?
Let's get
Are
some
we
more
ready?
people up front here.
Push in, staff.
Yeah.
Okay. 1, 2, 3.
Mental health access.
Very good. Okay, let's do it one more time and let's cut that ribbon. 1, 2, 3.
Mental health access.